When I think about my life and my history, it started even before the US. The Civil War broke out in Cambodia in the mid-70s. My parents, like hundreds of thousands of other refugees, just picked up whatever was on their back, clothes, their kids, and walked on foot to a refugee camp in Thailand, hundreds of miles away. And I was born in a refugee camp, so I consider myself a child of war. And then we came to the United States. And I've been here since I was about 5 years old. So I grew up in Revere, Massachusetts, named after Paul Revere. It's also the first public beach in the US. If you take a snapshot of Revere and what the community has gone through, it's the quintessential Southeast Asian American refugee experience here in the US. We were bullied by the state, by the police, by the school. From when we first started, to all the violence, to everything that's happened, to now people doing a little bit better for themselves. It's home for me. It's my roots. It's where I learned to be, it's where I learned to be an American. Early on, my parents joked to me about their plans for us in life. You have to find a wife and a husband. They have to be light-skinned, preferably Chinese, hardworking. Then you guys gonna have a lot of babies, be a happy family, and then we can die happy. A big part of me wanted to believe that. I mean, I didn't want to disappoint my parents in that way. I was also seeing the message around coming out in mainstream gay culture as sort of this big epiphany where you kick open the closet door, you don't care who accepts you or not, you be who you are, right? I knew that wasn't an option for me either. I can't fit into that model. I don't have the luxury to not care about whether people care about my coming out or not. What I want to say next was that, Mom, I'm gay and I'm attracted to men. But I couldn't say it. I couldn't say it in English or in Khmer. I couldn't say it in English because she wouldn't understand. I couldn't say it in Khmer because there's no language. There's no words for it. So what I ended up saying was, Mom, I'm one of those people that likes people of my same gender. Really sort of roundabout way in saying that. And she understood. The first thing she said to me after that was, don't ever tell your dad. And then the second thing she said was, you are my son. Thank you for letting me know. I just want you to be happy. But these are the ways I think that you'll be happy, which is to have a wife and to have children and to... So it's still an ongoing debate for her. We're at MAP for Health. MAP for Health stands for Massachusetts Asian Pacific Islanders for Health. As a person coming from the community, talking about sex in the Asian American community, sex is such a taboo, sexuality is such a taboo, that when we talked about them, oftentimes people just thought we were being too Western, too American. AIDS is a gay thing. Before we even began talking about the virus itself or how it's affecting the community, we had to first start addressing and dealing with these sexual cultural barriers in the community. So most of the time, I think a lot of our work is in breaking down those barriers. The work that we do here, we have to appeal to the state, we have to appeal to other organizations to make the case for them to even care about the Asian community. Part of it's just that we also have to be fighting the model minority myth of Asians being well off, as Asians being okay, as Asians being healthy and strong and smart and rich, when that's really not the case. We do know that our young queer Asian men in the community are contracting the virus or other STIs, and that there's very little service dedicated to meeting their needs. Improving the health of our young people is an integral part of creating change and helping our community to be better.